So it seems from the start there's a very kind of a broad conception of what it is to kind of engage in healthcare rather than, maybe more restrictive pharmacological interventions where you have a kind of detached kind of hierarchical relationship between the caregiver and the patient. Is it right to say that this seems more of like an empathetic, more wide-reaching way of engaging with someone's health?
Absolutely. I think I can't help but be a historian because that's who I am. So I think some of the historical context is also critical here, because if you imagine, in 1952, 1953, the word psychedelic, or sorry, I'm zooming ahead, 1956 is when the word psychedelic actually is coined. But in that period, Osmond and others are coming out of more of a psychoanalytic environment. And I know that's a fairly broad generalization, but if you imagine the kind of training that psychiatrists were going through in the 30s, 40s, and 50s, they tended to be focused more on psychotherapeutic, psychodynamic, psychoanalytic kinds of training sessions. So different from a psychopharmaceutical paradigm, which comes a little bit later. The first antipsychotic medication, which is released in 1952, becomes a blockbuster, chlorpromazine or thorazine, largactil. This drug becomes a landmark for changing the way we think about pharmaceuticals applied to mental illness. But that happens really at the same time that drugs like psychedelic drugs like LSD and mescaline are being tested. And so the context for running those experiments was not yet RCTs, was not yet within the kind of pharmaceutical paradigm. And so I think there was more, I guess maybe there was a little bit more acceptance of thinking about physicians, clinicians taking those drugs and then monitoring their patients. It wasn't necessarily considered unethical, because if anyone had gone through psychoanalysis, the only way to become an analysan is to go through your own therapy first. So it followed a different kind of ethic for how we sort of articulate empathy and the power or the sort of significance of empathy in a psychotherapeutic setting. So if we zoom ahead 10 years from then, that context changes quite dramatically as we embrace randomized controlled trials as a kind of gold standard. And we really prioritize that kind of objective or distanced observer rather than one who is, holding hands with their patient or going through something that they may have some direct experience with themselves.
Yeah, I mean, this sounds very resonant with what you said at the start about the kind of reductionist mode of kind of extracting things from nature and extracting substances from different traditions. And it feels like in the 60s or the 50s, you had this potential for the reductionist kind of pharmacological model that has now kind of come to dominate healthcare, but also this more complex, nuanced, and harder to profit from, I would say, I guess, right? Model of psychedelic therapy.
Yeah, I find the prophet stuff fascinating, and something that at the time when I was doing the research in the early 2000s, I think I was sort of vaguely aware of, but I didn't appreciate just how prominent it was. And it's really upon reflection that I see this as a bit of a missed opportunity. But the economics of it are fascinating, because in the context of the region that is trying to show the world it can create a publicly funded healthcare system that embraces these kind of like economically efficient models of healing, this one session, single dose session of a psychedelic psychiatry is like really powerful, really exciting for someone who's looking for making a budget line for how much we're going to spend on healthcare. If you're a pharmaceutical industry, having a single session is probably not the most economically attractive model that you want to support. Daily use pharmaceuticals, which become the norm by the 1960s, and certainly since, those are much more economically viable. So depending on the perspective that you're at, I think there are these really interesting sort of political economy perspectives that are woven into this story, and I think nicely sort of fit with the mythology around psychedelics, that they are more libertarian or more socialist. And I'm not sure that all of those myths are really accurate, but I think there's something to the kind of, taking it to the man, sort of notion that psychedelics embolden this kind of championing of a different kind of ethos. And I don't know, the symmetry is quite nice.
Yeah.